Let's now ask a few questions regarding the COVID-19 and what the government is doing. And now we bring Professor Sam Kariuki. He's the Director of Research and Development at KEMRI. Dr. Prof, good to see you. Let's begin with asking the question that many Kenyans are wondering, how much further can we wait for a vaccine or a near solution to this, Dr.?
Thank you very much, Ken, for having me online. I think this is an area that everybody is asking questions about. But at KEMRI, I can tell you that we involved to a great extent, together with other partners, to do certain clinical trials, and especially with regard to treatment. And we have formed teams, and especially working with the WHO Solidarity Trial, to look at the effects of hydrochloroquine and also chloroquine in terms of alleviating the disease in terms of treatment. At the same time, we have teams at KEMRI that have also engaged in trying out vaccines, and these are going to be helped very much by the work we are doing on what we call whole genome sequencing. We are looking at our own viruses that we have been able to isolate locally to be able to know the genetic makeup of these viruses. And from that information, we'll be able to obtain data that can be used to specifically look at certain elements of the virus that can be used for making certain test samples for vaccines. But this is a long process that we are working together with other partners.
All right. Prof, perhaps the other question that is related to what you have spoken about, isolating this virus to try and find a solution. There is a report that people who have recovered from the coronavirus elsewhere in the world, not necessarily Kenya, the blood is being drawn and being used to try and develop a virus. Is that report really true?
I'm not sure that is a really true reflection of that, because you can draw blood to try and understand what antibodies have been developed specifically against COVID-19. And that can be used to some extent, of course, in terms of understanding how the body reacts and how we can make a protection for this virus. But I think this is a long process. It's not something that can easily be done in a short time. It requires a process of clinical trials to be able to understand clearly what works and what doesn't work.
All right.
You may have seen in today's BBC report that
yes,
some of these antibody-based tests and treatments are really things that are unprecedented, and we need to be careful about how we are able to attest to their efficacy.
All right, let me bring you, let me get you out of the country. I'll bring you back to Kenya in a short while. But please tell me, what has the world been waiting for? Because we have seen several history clips, if I may call them as such, clips of President George Bush, President Obama talking about this. And I also understand there was a conference on flu last year in the US. And these things have been spoken about, but we don't understand what the world has been waiting for. Really, what has been hindering the world from getting closer to getting a cure for this virus? Yet it's been spoken about for probably the last 10 years or so.
I think the main issue here is that this is a new virus. And for every new disease pathogen, we need to carefully understand the genetic makeup of the pathogen before we even venture into trying prototypes of vaccines or other treatments that may work. And that's why there's a lot of concerted efforts towards trying out other products that have worked against other viruses, trying out other products that have worked probably in a way to alleviate the symptoms that are caused by COVID-19. And an example of this is the two that us in KEMRI and with our partners are teaming up to be able to put that into a clinical trial concept so that we understand how this can truly alleviate the symptoms of COVID-19. So it's unprecedented. It is something that will take time to fully understand the genetic makeup of this particular virus and how it affects the immune system of the humans. To be able to come up with actual treatment.
Okay. I know several organizations, several governments have been trying to do this. There are about 30 or so organizations and institutions trying to find this. There are reports that the initial vaccine that has been developed was tried on a monkey and it worked. Is it true, just in a very short answer, is it true, or this is one of those false narratives that we see online?
I think for every vaccine, there are various stages of trial before it really can be even tried in humans. And if it works in the animal models, then it's likely then that it will be approved to be tested in humans. But it's very, very important that the vaccine goes through the due process of trying it out so that by the time it comes to the human trials, we are absolutely sure that we will be able to get benefits rather than having effects that may be detrimental to human beings. So it has some substance that this has been tried in animals before, but then it requires to go through due process for human clinical trials.
All right, I have about 30 seconds. I don't know how you're going to manage to answer this. My colleague Merab is asking, South Africa and Nigeria have shared their genome sequences. When are we likely to see Kenya do the same?
We have recently now concluded sequencing 22 of our samples, and by next week, this will be published. Okay. So we have the full genome sequences now of 22 samples, and this is what we are going to use to be able to utilize that information for further testing for any vaccine, for any point of care tests that we need to develop.
Okay, and just finally, in about 15 seconds, Kenya is now on the community transmission, and yet only 11,000 tests have been done as per the Ministry of Health against a population of 48 million. In your opinion, are we slow in testing? Don't we have the testing kits and the reagents here? What's really happening? In a very short answer.
We have now all the kits that we require, and you had our CS, Mutai Kagwe, mentioned that there will be hotspots that will be targeted for further testing. Okay. And we are ready for this. We have centers in Nairobi, we have centers in Kilifi, we have centers in Kisumu and Alupe, Busia, that are ready to test up to 5,000 samples per day. So we are ready for this mass testing.
All right. Thank you very much, Professor, for your answers. And obviously, we had so many questions, but we are limited in time, especially what KEMRI is doing to help the government distribute and even bring the samples here. We're sorry we've run out of time, but definitely we'll get another opportunity. Professor Sam Kariuki, Director of Research and Development at KEMRI, speaking to us there.